see like somebody with like a little arm, or shriveled up arm, and I would ask my mother what happened. And that was, she would tell me they had polio. So in some cases, that virus reaches the bloodstream by way of the lymph nodes, and then it causes a transient viremia. In other words, the virus gets into the blood. But for some people, then that's all they have. It goes away and they don't get the disease. But in about 1% of the cases of this viremia, the virus is persistent, and it penetrates the capillary walls and enters the central nervous system and causes the paralytic form of poliomyelitis. Most of the outbreaks are during the summer and fall, and polio is still endemic to parts of the, developing countries. So, signs and symptoms for non-paralytic polio, the majority are either asymptomatic, or they might have mild symptoms like a headache, sore throat, fever, nausea, muscle pain. The paralytic form, the virus affects motor neurons in the spinal cord, and it causes flaccid paralysis to the muscles of the tongue, face, neck, and limbs. The virus doesn't infect the muscle or the peripheral nerve. The paralysis is from that death of the motor neuron. And if you get paralysis of the diaphragm, then that can lead to death. So they came up with this little machine called the iron lung that they would put the patient in, and then that machine would breathe for them. And your book shows you a picture of, of the pictures of the iron lung. But there was a TV program back in the time that they had polio called The Man in the Iron Lung. And he was a detective. And his whole thing was he was doing his cases being in this iron lung. I've tried to find it, but I can't find it, so I don't know how to even see who the actor was. So unused muscles atrophy, and you get severe deformities of the trunk and the limbs. Your sensory nerves are not affected, just your motor neurons. So those crippled limbs are painful. You still have your sensory neurons working. Here's a picture of somebody that had polio. Picture of another guy. Here's a picture of an iron lung. This person, they actually used to have rows and rows of these in the hospital, and your book has a picture of it when they had epidemics of polio. And this poor woman, she has a mirror there so she can see something. And since her son's in jammies, I think she probably has her iron lung at home. So you would suspect polio if you have epidemics of neuromuscular disease during summer months in temperate climates. They now can do RNA fingerprinting to see if it is a wild strain of virus or whether it is a vaccine strain of the virus. You can isolate the virus from feces or throat secretions, and then you can inoculate cell cultures. This is when I worked with polio, this is how we did it. The virus has to grow inside of a cell. And then when you inoculate those cells, then you look at them every day for so many days, and you're looking to see if there's any cytopathic effect or CTE on those cells, and that's how you identify it. For preventing and treatment, try to alleviate the pain. They may need artificial ventilation. Nowadays, people that have polio, there is a few people that still go in from that era, that when they had all the polio, that still go in the iron lung for a lesser period of time. And then they have, ones that you can carry to help you to breathe if you've had it. They have a vaccination. This vaccine came out in 1955. The person who came up with it was Jonas Salk. It is a inactivated polio virus. In other words, they took the virus and they killed it. Just enough stuff so that it can cause your immune system to make antibodies against it. It's a trivalent one, has a combination of 3 serotypes of the virus, but the antibodies then decline with time. Now they use an enhanced potency inactivated vaccine in the U.S. And most of us don't get booster polio stuff either. When we were working with the polio, there was a girl that was trying to, you have to force the liquid with the cells. You're trying to separate the polio virus from the cells. And she was putting it through a filter that was on a syringe. She was really pushing and pushing. I was standing by her. It came off and she splashed me in the eye with polio. So I went to, whatever our work had, the doctor, and they ran a blood test and said that my titers were up, so it caused my body, so I had my my booster. It was just in my eye, caused my titers to grow. Oh, goodness. After Salk came out with that one, with that vaccine, you would get a shot. You injected it. Then they came out with, in 1963, they came out with the Sabin oral polio vaccine. And the problem with this one, it can revert to virulence, meaning it can cause, sometimes when you get this this vaccine, it can actually cause the disease. Now the U.S. cases are from vaccine-derived viruses. In 1988, the World Health Association launched a campaign to eradicate polio by 2000, which it hasn't done, but it's well on the way, and the cases have fallen by 99%. When, they don't use the Sabin anymore because of this, but you could get the Salk, and that would give you immunity, and then you could take the Sabin and not come down with the polio, because you've got some immunity from the injectable one. But the Salk one is expensive, and this one's a lot cheaper and easier. You can take it anywhere. They put it on a sugar cube. Any of you had it? Polio? No?
I think I did.
Rabies. Rabies is zoonotic. What does zoonotic mean? Yeah. It can spread from animals to people. It's a viral disease as well, and it's characterized by a fatal encephalitis. So the virus is in the genus Lysovirus and in the family of Rhabdoviridae. It is a bullet-shaped single-stranded RNA virus. I'm gonna show you a picture. To me, it looks like, you know, the lipstick that you take and turn and it comes out. That's what it looks like. It looks like a lipstick. I guess it looks like a bullet. It is the highest mortality rate of any human disease once symptoms have materialized. And very few people have recovered from active cases of rabies. So there's a picture of the virus. See the capsule around it? And it's got
Pretty.
protein spikes on it. Rabies occurs in many warm-blooded mammals. And the virus enters tissues through a skin wound that are contaminated with body fluids from an animal that has the virus. Initially, that virus proliferates in skeletal muscles and in the connective tissue, and it can remain there for days to months and stay local. Then it's going to enter a motor neuron and move towards a central nervous system, and it can move at between 15 and 100 millimeters a day. So there's 10 millimeters to a centimeter, so say 10 centimeters a day, and an inch is 2.5 centimeters, 2.54. So can move about 4 inches a day up that nerve towards your brain. Now the virus has adapted and it can grow in epidermal cells. So now it can enter a peripheral nerve by you just contacting and petting an animal that has it. Say if your dog had rabies and licked its fur and you petted it, it can go through those epidermal cells. There's been several cases transmitted through transplanted body tissue, such as cornea, that have been infected with the virus. So signs and symptoms. Incubation period is 1 to 3 months. However, it's shorter if you get somewhere closer, like your face or neck, or closer to your brain. During the prodromal phase, there's fever, nausea, vomiting, headache, fatigue. There's 2 forms of the disease. There's furious and paralytic. In the furious rabies, the first sign is a period of agitation, disorientation, seizures, twitching. During this phase, animals and humans, whoever has it agitates them so they want to bite. This is the way that it gets spread. So you have to have some mechanism for the animals to spread it. So they bite. Spasms of the mouth and the pharynx muscles lead to severe pain when you're swallowing, and so that leads to hydrophobia, or like a fear of water, and it's usually fatal within a few days.
So like in the animals, rabies it inhibits control systems so they become like enraged. That's
Yeah.
what happened with
It would, even with you, if you were to get it, you would be agitated and